Hi, we are from Group 3B, and the skull injury at the bilateral lower limbs is our topic. And this is our team members. And this is the purpose of our presentation. This is the outline of our presentation. Hi, I'm Sajrata Adamutina, metric number 53712, and I'm gonna explain about the history of the patients. Ahmad, 4 years old, who was diagnosed with 20% TBSA, superficial to mid-deep dermal over bilateral lower limb. He had the past medical history of bronchial asthma, no past surgical history, no allergic to food and medication. Weight is 14 kg. The reason for current hospitalization was because of allergic scalded by hot water. This is the vital signs of the patients, where the patient's pulse is 122, respiration 33, temperature 38.1. The pain score is 5/10. Patient is independent, normal respirations, and does not need any oxygen therapy. The total GCAs is 15/50. On IV line on his right hand, and patient was conscious on that time, and all his condition on that time is normal. Patient's complaint: patients crying due to pain of the superficial to mid-deep dermal over bilateral lower limb. And the clinical manifestations were blister at both bilateral lower limb, pain 5/10, scalded from superficial to mid-deep dermal, and had the hyperthermia due to post-surgery.
Hi, I'm Normizan. So I will explain about the normal anatomy and physiology, and this is function of the skin. The first one is homeostasis. It acts the protective barrier to our body and maintain the internal metabolic equilibrium. The second function is protection. Skin will protect from many forms of the trauma and act as protection from internal factors such as microorganisms. The sebaceous gland will secrete the oily and slightly acidic substance. The next one is thermoregulation. It has the ability to regulate rate of heat loss and gain, and has the ability to regulate contraction and dilatation of blood flow during temperature change. This is the layer of the epidermis, each layer of the epidermis. And next is a characteristic of each layer of the epidermis. The second layer is the mist. The mist consists of two layers, which is papillary layer and reticular layer, and it has the specialized structure. The next layer is subcutaneous tissue layer. It is the innermost layer and made up from fat and connective tissue. Act as the insulator and regulate temperature, and it acts as the protection from damage and has the passageway from nerve and blood vessel from the mist to muscle.
Hi, I'm Nashibika Mtishahrom. I will explain about the pathophysiology in patient's case. This is the process that takes place in this case. This case is due to the hot water. It will undergo skin loss that leads to loss of skin barrier. Loss of skin barrier can cause inflammation and loss of fluid. Correspond is portrayed under the Jackson's burn model. There are three zones in this model. The first zone is the zone of hyperemia, where the skin tissue undergo inflammation due to loss of skin barrier. The characteristic of skin inflammation can be reversed. Second one is zone of stasis, where the tissue perfusion is decreased. Tissue can be repaired if it undergo resuscitation. Lastly is zone of coagulation, where it is known as zone of necrosis due to maximum damage of tissue. One is systemic response, which include metabolic and immunological changes. Under the metabolic changes, the basal metabolic rate is increasing. In immunological changes, non-specific downregulation of immune response occurs. Lastly, risk of hypertrophic scar formation. Age, severity, type, and location of the burn are the factors that determine the scar formation. This due due to the disorganized manner that give different textures and appearance.
Hi, my name is Nur Hidayah and I'm going to explain about the nursing assessment, which is ABCDE assessment and burn severity. ABCDE assessment. First is the airways, where we need to assess for the SpO2. In these cases, patient's SpO2 is normal and did not show any sign of inhalation injury. Second is breathing, where we need to assess for the respiration rate. This patient breathing pattern is normal. Since the burn affect the lower limbs only, thus the respiration system are not affected. Third is the circulation. The patient is given fluid resuscitation. Use Parkland's cannula. The patient's capillary refill are normal and there is no edema. There is an LV planula at left hand and no sign of thrombophlebitis. Fourth is disability. Patient need assistance from his father and mother to perform all his activity daily life. So lastly is exposure. The dressing is intact and we need to assess for the sign of compartment syndrome due to the circumferential burn injury. Burn severity, which is based on depth, size and location. Based on depth, it is superficial to minimal. Superficial involve the epidermis and part of the papillary dermis, and minimal involve the epidermis, papillary dermis and varying depth of reticular dermis, which may be painful. Next is the size. We use the line and borders chart, which is more accurate with Albers method, and the total body surface area is 30%. The location of the burn wound is in bilateral lower limb. This is the line and borders chart that we use, and this is the total body surface of the burn wound at the right and left leg from anterior and posterior part.
Hi, my name is Nurul Atira binti Zaini. I will talk about medical procedure, medication and nursing management for patient. Medical procedure for patient. Check vital sign and SpO2 because tissue destruction, cell rupture may cause arrhythmia and cardiac arrest. Check for internal organ damage, edema and lung capacity through chest X-ray. Check acid-base balance through ABG test. Intubation may need if suffer toxicity. Medication for patient. This is medication for patient, 3 types of dressing product and a few types of medication. IV cefuroxime is cephalosporin antibiotic which prevent bacterial infection by killing sensitive bacteria. This is contraindication and side effect. For cefuroxime, nursing responsibility, inspect the IV site for sign of phlebitis. PCM treat mild to moderate pain in fever. There's no side effect but may be some health allergic. Nursing responsibility, check patients not take any medication contain PCM, and for children, use syringe to squirt liquid slowly into the side of child's mouth. Piriton used for cold relief, watery eyes, runny nose, sneezing, and contraindication hypersensitive to antihistamine, and the side effect is loss of appetite, headache, constipation, and drowsiness. Morphine is an opioid pain medication used to treat moderate to severe pain. Contraindication: cranium injury, breast intracranial pressure, and the side effect is drowsiness, dizziness, headache, nausea and vomiting, anxiety, and feeling tired. Bacterials act as a barrier between the wound and a secondary dressing, and Aquacel AG kill wound bacteria held in the dressing. It absorbs high amount of wound fluid and bacteria and create a soft cohesive gel. Deep Seal AG range of steroid calcium alginate dressing provide antimicrobial protection and absorption, release of silver iron, prevent and reduce infection to the wound. Nursing management for patient. For manage the pain, morphine is given to patient and patient feel comfortable. Patient blood is taken for examination, chest X-ray done, and it is cleared, ABG done, and wait for result. vital signs record continuously and
Hello, my name is Shamini binti Muhammad Rawi, and I'll be doing the nursing diagnosis and the nursing care plan. On the 13th of March at 9 a.m., patient has complained of pain at bilateral lower limb with a pain score of 5/10, and he was crying and also restless. The nursing problem was that the acute pain is secondary to injury by scalp, as evidenced by the reading of the pain score 5/10. The goal was that patients will verbalize the reduced score of pain to 2/10. The nursing intervention for this patient is to monitor patient's vital signs to see any worsening changes as it may indicate the increase of pain. Encourage patient to stay for bed rest to minimize the movement of both the bilateral affected limb. Gives psychological support to the patient by not leaving the patient alone when he is in need, and show some empathy. Divert patient's attention from pain by talking and provide pause to prevent patient from focusing too much on his injuries. Administer analgesic IV morphine (IMG) to relieve patient from the pain he is currently experiencing. The outcome of this assessment is that the patient verbalized the score of pain has been reduced to 2/10. In the second assessment, the patient is found to be febrile and has a warm and clammy skin. His body temperature was 38.5, which is higher than the normal range of 36.5 to 37.2. His respiration rate reading was 40 beats per minute. The nursing diagnosis for this patient is that altered body temperature related to swelling process and increased evaporation rate on scalp wound as evidenced by body temperature of 38.5 Celsius. The goal for this patient is to reduce patient's body temperature to its normal range. The nursing intervention for this patient is to monitor patient's temperature hourly. This to determine any changes to the body physiological function. Allow clear fluid as tolerated. Help patient to maintain hydration as fluid is lost through evaporation of sweat. Do tepid sponging to patient to allow water to evaporate and cools off patient's skin from discomfort by the process of evaporation. Administer syrup paracetamol 4 times daily as PCM works to override prostaglandin-induced increase in temperature. The body then works to reduce the temperature, which results in a reduction in fever. The evaluation for this assessment is that after the intervention, the body temperature has been reduced a little bit over the normal range of 37.7 Celsius.
Created using Powtoon.